Good evening, Heart for the Community Initiative. Hello, Facebook. Hello, YouTube. Welcome back to another episode of the Heart for the Community interview series. We set out earlier this year. I think we did our first episode back in March. And the whole idea was to keep the community informed during the worst part of the COVID-19 pandemic and lockdown. And the show has blossomed since then. We have done a host of different guests, and we've done a few panels, all sorts of ideas, all sorts of ways to keep you informed. And tonight we have brought a very special guest in. I probably think way more of Supervisor Allen than she even knew. She is a local hero as far as I and many of those who work with me in the various groups that we work with, trying to work on a social and racial justice and reform. And she is just an awesome person. Quiet power is what I think about when I think of her. She is a tremendous person. She does so many things for the community, and I love the way she does it. She does it quietly. She's silent power. So listen, you have a moment just before we get started here to tell your friends, your neighbors, your family members, the Heart for the Community Initiative. We're back on the air. You can start a watch party. You can share this video. Let everybody know that we're here. And as usual, my wife and number one fan, Tinesha, is the first one to greet us. There she is. And she loves you too, Supervisor Allen. So for no further ado, we have Stafford County Board of Supervisors, Supervisor Tinesha Allen, and she has consented this evening to give us some updates on a few items, COVID-19, some of the political and civic issues going on in the county of Stafford right now, and also a very recent vote that the council took, the flagpole ordinance. So Supervisor Allen, thank you so much for taking time with Heart for the Community this evening. Welcome back.
Thank you for having me. Well, hello, everyone. Good night. Um,
You must be
as
West
Mr.
Indian.
I must be West Indian. I definitely am.
That's right. You said good night.
Yeah, I definitely am. But thank you guys for having me again. And I'll try my best to answer as many questions as I can and as truthfully and as transparently as I can. As Mr. Armstrong himself noted, I don't um, do too much public talking outside of the board. I kind of like let my work do the talk for itself. So this is one of the few opportunities that um, I do as public appearances. And that's mostly because of the pandemic. It makes it harder for us to have platforms to be able to do this, and our schedules are so busy. We're like one of the only counties that the supervisors don't have their own staff. Our colleagues to the north, Prince William, Loudoun, Fairfax, Alexandria, Arlington, they all have staff. So in Stafford, unfortunately, you're also the county supervisor and the staff.
Oh, wow. That is a heavy load.
Well, part of it is, I mean, the argument can be made that it is a mechanism to keep the levers of power in certain hands because it's truly a full-time job, but you don't really get compensated. Like what I get compensated is not even equated to the amount of work that I do. Um, but if I truly had a budget that's akin to my colleagues, there's so much more that we would be free to do. For example, Prince William, they have a staff budget of I think like 250,000 or some ridiculous number. We have a staff budget of zero.
Oh, wow.
Fairfax has $1 million budget each supervisor gets because it's truly a vast undertaking. But if you take on a job like this where it's 20 grand a year you get paid minus taxes, are you do you really have time to take on a second job? So consider who has been managing the county for all these years, right?
Right.
Um, it's people who are affluent or who are retired that have the time and the resources.
Wow.
So I bugged the
Well,
trend actually.
I'm glad you're sharing that because there are some ears tonight and some people who maybe can get in front of that council and make some suggestions and start pushing, because I do believe.
Well, I mean, right now the pandemic hasn't helped in making that argument to have us have a budget. But my hope is in a few years, regardless if I'm on the board still or not, that subsequent supervisors have that ability. Because I'm telling you, because you have to do so much layman's work for an issue. At least I can speak about myself. Um, it it doesn't allow you to put in as much effort into different other subject matters. However, I do. I mean, my planning commissioner always jokes that he doesn't know how I can tackle 5 different subject matters at the same time in school. But unfortunately, that is the task that I signed up for. And as the county gets older and grows, it's just the next logical step because it allows you to do so much more. And maybe subsequent boards will change that. But as a county of Stafford size, and as it continues to grow and have needs, the current status quo can continue.
Well, I'm glad you shared that with us, and I want to jump on that. Gary Holland is here with us. He says, "You're awesome, Supervisor Allen." Of course, everybody knows that Gary Holland loves Supervisor Allen.
Yeah, I know. He's always telling me why am I not uh, making politics my full-time career. Every time I see him, this is his statement.
I second that motion. You
Yes.
got enough juice to run for high office. We're gonna support you.
I mean, I'm a different, as we say in Brooklyn, I'm a different cat. I'm not cut the same way as people, so
That's why we love you. That's the
I don't
whole thing.
I don't know how to do I don't do the politician-y, if that, that's not a word, but I don't do those things that would endear me to the powers that be. Because my thing is, and this is advice whoever's listening out there, because next year we do have 4 supervisor seats that are up. But my thing is, I try to limit as many masters as I have, right? Because when you get into politics, once you start, asking people for money, people obviously expect a quid pro quo. I mean, for lack of a better phrase. So I try to be very, very selective in picking out who I would want to cash in that favor. Because people will tell you, "Oh no, I won't," but you kind of have to have that at the back of your mind. Okay, who am I going to owe a favor to? And so for me, it was always, if I owe someone a favor, it has to be someone that's not ethically challenged and morally bankrupt.
Right.
And unfortunately, as you climb the political ladder, you come across so many of those people that, I'm the type that says, "Listen, I don't rock with you," and I'm okay with that, because I could have raised way more money than what I ran with, but I chose to keep it to only people that I know that I wouldn't serve as a master to. Because it frees you up to do whatever you want. No one can call me and tell me, "Well, why didn't you do this for me?" Or "I remember." I'll say, "Okay." I don't care. And it handicaps you. A lot of the things that's wrong with government, to be honest, is that money that's in politics. Is you have money from competing interests that, as a politician, you run to improve people's livelihoods. But then because you're taking money from so many outside forces, you end up serving their interests more than the people that you supposedly ran to highlight. That's one of the reasons governments move so slow.
Well, one thing I've learned, and I remember the old folks saying this coming up, but being an adult and living a little bit, you understand favors are not free, but favor, God's favor, we only have to pay that back to Him. And I think you got some of that.
Well, see, that's what people say. But my thing is I want people to know who they're investing in. And so my thing is if you believe in what I'm doing, then you have to allow me to do my job. We may not always agree, but if you're going to invest in me, whether it's your time, your resources, or whatnot, then you just have to let me do my job. And you can't be someone that hampers me from doing my job. Because I look at it in a holistic approach. If I'm able to better the life of the most downtrodden person in our community, it will have a trickle up. That's the one time that trickle up effects work, where
Right.
where the bottom people wouldn't necessarily have to depress the economic and financial and educational and social and health burdens of society, because they would be taken care of. And then you at the top, the ones that be, you wouldn't have to worry so much about, your tax dollars, or finding ways to suppress their ability to be a human being. So, but I wouldn't digress about that. But yes, that's why I do stuff in the, behind the scenes, because I don't do it for glory.
Well, let me ask you this. What are a couple things, if you don't mind sharing, that you have had an opportunity to have a hand in since you have been on the board that you think have been very affecting, positively affecting to, like you said, the least of these in the county?
So the pandemic kind of threw a wrench in a lot of the stuff that we wanted to do, because you kind of have to pivot and focus on all that comes with dealing and governing in a pandemic. So for me, having to legislate during the pandemic has not been the greatest, especially because the way Virginia's is structured, with the Dillon rule, having to rely on the state to do so much in terms of setting certain agendas or budgets or whatnot. It creates that dependency, in a way that most local governments and other in other states don't necessarily have. But one of the things that I pushed for was, adjusting our ordinance for the flagpole. Um, I have also um, tried to, this is one of those places, try to figure out ways that we can advance our roads, in terms of making it more efficient, having real progress where people can see. Um, but to be honest, the pandemic has done so much damage that we don't really have as much leeway in doing things. It's only now that I've started to put stuff out there. Like, for example, I brought to the board, our last board meeting, an agenda item to fund our EDA, in a way it's never been funded. The EDA is meant to promote economic development in Stafford, and not as, the body it's currently being used. It's not being used, at least by the board, effectively. So one of the things I brought up was for us to use some of our CARES funding money that we had reallocated, to fund it. And my thinking was, and I said that at the board meeting, was to fund entrepreneurship within Stafford, because Stafford loses roughly almost over 600 million dollars a year to outside counties for services and amenities that we just don't have. And so my thinking was, well, if we can even give, at first I said 500,000, but that was just to get a number out there. But if we were able to give, even $250,000 and fund 10 small businesses, and if two only grew out of that, I mean, the return on investment is not even in the ballpark in terms of how profitable that would be for Stafford. We get to hire our own, we get to have the tax revenues that stay here, and we get to have, in my mind, a proof of concept of, you have a board that is willing to support local businesses in general. Because, for as much as people brag about the stock market and all that stuff, it's small businesses that really drive our economy. And with this pandemic, with so many small businesses closing, that's been detrimental to most communities. And so I was like, well, the only thing that's going to save us are the small businesses. So why not utilize the highly skilled and highly educated workforce that we have here in Stafford, some of who have been home working, or some who were laid off, and who might never have thought about being an entrepreneur. But maybe this pandemic has given them the opportunity to start thinking about tapping into those skill set. And even though interest rates are ridiculously low, we know that within certain communities there are barriers to borrowing large sums of money. And so I'm like, listen, the federal government has a small business association that invests in companies and helps start businesses. Why can't the county do the same thing? So that's one item that I brought forward that I think in like another, I think maybe the December 15th meeting, I suspect we're going to decide if that's something the board wants to do. Um, some board members had trepidations because they don't believe that's what the government should be doing. But I'm like, literally, there's a branch of the government that deals with small business.
Right. That's right.
So the state does it. So why don't we do it? I think it sends a good message that hey, we're going to invest in you, and invest in your skill set. Um, so that's one I've been working on. The other one that's been the most pressing issue because a lot of our stuff, like I said, got pushed because of COVID. Because there were months when we didn't have meetings, and then when we did have meetings, we had so much financial ramifications and financial nuances we had to work out. So it's not until I would say maybe September is when the board finally started to think about some of its objectives that we talked about in the beginning of the year. So the EDA was one. The other one, as I said, was the flagpole issue. I wanted us to have our flagpoles be in unison with what our code was, and it didn't make sense to me that flagpoles were the exceptions to that rule. We already have a code about monuments and statutes. Flagpoles should have been able to, fall in line because if you can't build a monument or a statue past a certain height, your flagpole shouldn't be past a certain height either. It was a great delight that it just coincidentally happened that 95 flag got took down. But
That
it was
was an
just
eyesore for years.
but yeah, so that was one that I pushed for. I pushed for the EDA, and then the other one that we're working on right now, which is the big one, basically, is downzoning. We had a meeting scheduled, a joint meeting with the Planning Commission in October 17th, I want to say. And then we're going to have the final one on December 15th to wrap up the year. And that one is huge because it's going to have an impact on how Stafford sees itself growing, how we manage growth, and how people can protect their land wealth. There are a lot of Black families that are going to be impacted by this. And, my thing is, and I ran on this, is Stafford has been growing in such a way that it's not cohesive.
Mm-hmm.
And we have something called a comprehensive plan, which is basically something that every county is supposed to submit and update. And it gives an idea of how you want economic development, housing, businesses, all of that stuff. And half the time we may have a comprehensive plan that says A, but then the boards were doing something that was B, C, D, E, F, G. And it created a lot of mixed messaging because developers didn't know what the board's priority was, how true they believed the board's vision to be, because then the board will deny projects that they wanted in their comprehensive plan targeted areas, or they're called targeted areas or urban service areas. And then they'll say, well, if you're going to deny me in here, then I might as well go into the suburban pockets, which is right outside the major arteries, which is Route 1, 610, 17, and Courthouse. And I'll go as far out as I can buy land that's cheap, because you're going to deny me within the urban service area and within the TGA. So I might as well go out where I can buy, right, develop. And so with the rapid growth we have, which I suspect we should get our census numbers either the end of this year or early January, because we need it for our redistricting. But when you buy, right, develop, you don't get any proffers, because by law you're allowed to build a house every 3 acres. So developers were buying these large farmlands and putting up these big 3-acre lots, and you can have a family of kids, you can be doing whatever you want with the roads, and the county got nothing to help offset that financial burden. And so our rural roads are really stressed. Our schools are some of them are really crowded. We're in the process of having to build high school number 6. And soon after we build 6, we're about 2-3 years out before we're triggered to build elementary school. I think is 19. So the growth is so much that we didn't target it smartly. So when developers went out to the rural or the suburban areas, we didn't get any incentives from it. We couldn't get any proffers to help offset that cost. And then if you tackle that growth with a board that's fiscally conservative and don't believe in raising taxes or really having money to address real social issues, then you kind of have Stafford, in my opinion, bursting at its seams, like waiting to burst, because our roads are not in the greatest conditions. Our schools, are getting larger. We can't keep up with hiring teachers because we don't pay enough to compete with Fairfax, Prince William, or Loudoun. And then our public safety as well. We can't keep up with the amount of deputies or firefighters. Well, firefighters now we've gotten better than the deputies because we made a new pay scale. But before that pay scale, we couldn't keep up. So all of that growth stressed our resources. And I think we're like the second fastest growing county in the Commonwealth. And
it's amazing.
Yeah, I know. And so the problem is, the board likes to always say, I don't know how this happened. I like to say this board was completely conservative. Okay. How many boards before me?
We got a question here, if you don't mind answering. Can you share your insight on the upcoming downtown Stafford initiative? Do you think it's in the best interest of the Stafford residents now and future? And that came from Gary Holland.
So one of the things that the board decided to vote on this year, actually, that is one of the other things we went ahead and voted on, was to begin the process of a downtown Stafford. One of the first pieces of the downtown was the county giving its land in conjunction with Gerald Properties and the neighboring lot for them to construct a office. It's called a mixed use, like office and housing.
Mm-hmm.
And that is supposed to be the first tenant in terms of being a downtown area. But the whole concept is we want to have a area where people can walk and live and enjoy and shop and do all that. So we're hoping I think next year, if I'm not mistaken, would be when the construction process starts. And I don't mean the building. One of the reasons developers never really invested in a true downtown was because Stafford was never serious about it. So that vote signaled to them that the board is serious about trying to have some type of amenities. Because like I said, we lose like $600 million a year to neighboring. That's a lot of money. And our budget this year was 600 something million. So think about that. We lose our budget to neighboring counties. Now, I'm not saying we're going to be able to capture all of that, but if we can capture half of that, the amount of services, we could provide. So we're hoping that once that building goes up, that subsequent developers will come, because we're also creating a special zoning district for that, where it's going to be called urban development. I think it's UD, urban development. And that'll be only for that area where you can have mixed use, where, you'll have restaurants or dining or shopping or whatever, the office spaces at the bottom, and then up top are the apartments or condos, whatever you want to have. And then Route 1 in that area. So Route 1 from, I think it's called Bell Hills Road, right where Mason-Dixon Cafe is, up to Hospital Boulevard is supposed to widen as well to help with that traffic.
It's horrible there. The traffic is horrible there.
Yeah, so VDOT has given us a permission to do that. So we're going to be widening that section of the road. So that will help. And we're going to try to, have walkability, because that's the goal. So right now, I would say to see a future build out of downtown Stafford, you're looking at like a 10-year window from 2021, and I would say somewhere around 2030 would be when you can potentially see it fully built out.
Wow.
So he asks, should it interest us? Yeah, it should interest us, because when you're creating an economic center of any jurisdiction, you want to make sure that you get a seat somehow, so that you are not being left out of that financial puzzle. However you can fit in, whether you are in the real estate, you are in the development, you are in the retail, dining, however you can fit in. I definitely think communities of color, whether it's the Latino, the Black, the Asians, um, the Native Americans, whoever is in Stafford, absolutely you should try to be able to try to get a seat.
I want to
The
ask
movie
you,
theater.
yeah,
That's nothing to do with movie. I would say movie theaters are probably off limits right now because I've had conversations with developers. The pandemic has changed so much that I think once we've had a transition back to normalcy in government, in 2021, once government goes back to being functional and we don't have to be stressed, I think businesses will start to examine the effects of the pandemic because movie theaters, no one goes, even people that are COVID, who've had COVID already, they're not even going, and they're hurting. I know Regal closed down one of their branches in Fredericksburg.
yeah.
So you are going to, and then the nearest movie theater is the AMC in Woodbridge. You're going to have a very, very hard argument to convince a movie theater chain to come to Stafford to put a movie theater in there. Um, I think we have to probably put that one on the back burner until we can see what people's appetite for that is. Because I think people, I know for me, a bunch of people bought so much subscriptions to Disney, Hulu, CBS, Netflix, like
That's your
HBO.
movie
Yeah,
theater. Is at
yeah.
home.
So like my husband and I, we're planning to get a projector. You know what I mean? Who needs a movie? Because even now, a lot of movies are going straight to streaming.
Yeah,
Like Disney made Mulan. Mulan went straight to streaming.
yeah.
So I don't know if
COVID
that's
changed everything.
yeah. So I don't know where that market would be right now for that. I think probably the push, if I had to guess, would be because people are yearning for social interactions because human beings are social creatures. I think businesses would have to focus on creating a niche that allows for social interactions. I don't know what that looks like. I did cut the cable. I don't know what that looks like, but I think that's where it's gonna go is how to get people to be more connected.
I got a question for you. When it comes to the Stafford County Diversity Advisory Coalition, I know there are some differing opinions on that. Of course, I think what we have is better than nothing, but I don't think that we went anywhere near as far as we could have went to make real change. What do you see that we will be able to do as far as when they're dealing with racial issues, cultural issues, social justice, holding people accountable? What do you see going forward that we'll be able to do with that council?
Well, I know right now the council isn't going to start up until the new year. Um, so when we open up in January for the new board session, usually we'll take applications for all of our subcommittees from residents. So I think that's also the time where you can do it now, but that's be the ample time to submit your applications because the idea is that the multicultural would start up with the other committees in the new year. As to what we can do, you know, to be honest, the board just has to change in terms of who occupies certain seats because I think collectively it is hard for people to understand the plight of certain communities. I mean, I commend my colleagues for coming out to those, community talks we have, but some of them are still in disbelief that things happen.
Hmm.
Because everyone thinks, oh, Stafford, how can this happen in Stafford? Stafford is not like that. But the problem is, if you're insulated in certain communities, how would you know?
Right.
I'm privileged to know that I'm not. I see it. People I know see it. So I will always advocate for that. But the board just has to change, and that's the beauty is, if the board makeup change and we have people that, or even if the board gets reelected and the same people, maybe the new year we'll see different changes, but we still have the ability to in the new year bring this idea back up, which I pushed for, which was a human rights commission.
Hmm.
So I'm glad that we always have that flexibility, but Richmond still has a whole session to see what they'll do in the new session, because like I said earlier, because we're a Dillon rule state, if Richmond gives us the ability to do certain things, it makes it much easier for us on the local levels to follow up. Now, does that mean that all the board members are going to support that? I can't speak to that. But to be honest, the board just has to have a change in what they view and see. And for some people, the protests are not at their doors every day. They're not dealing with the injustices. So it's kind of that whole old phrase, right? Out of sight, out of mind.
I
But
have a
for some of
suspicion
us,
that the board is going to look differently after the next election.
well, we won't know until 2020. Is it 2021 next year? Wow, see the year with myself. 2022 will be the new board. So we'll know. I mean, who knows where the country will be. I do know in one positive news, the sheriff has been asking, he did come before the board to request support for body cams. So I commend him because I know he did show up to some of these community hearings and he heard the requests. And he's always been, um, you know, he's never been anti body camera. It was just a matter of can we get funding? And so
Right.
he has found one avenue of sourcing, but he needs a subsequent avenue from the board to help support that process. But he's at least asking us to consider that. So I appreciate that from him, from our deputies. I can say he does try. You know,
He
I've
does.
never.
I give up that. I give him that. So, as far as COVID-19 is concerned, do we have any idea if the governor is going to make any changes in the posture of our state? And furthermore, is there anything on the horizon from Stafford County as far as restrictions or anything like that?
Um, so I'm not privy to what the governor, he's already put us back into phase two. So I'm not sure if is aware of what phase two, because phase two was like the previous phase two, but he added a little bit of my new details. For example, the age of wearing a face mask went from 10 to the age of 5. Um, uh, you can serve alcohol past 10 p.m. 25 people are limited to a space now. So he has changed and pushed us back to phase two. But honestly, I don't know. I mean, I couldn't speak on what he's thinking, but with every day that our case numbers are going up, you know, it doesn't look good. I don't know if we'll ever go back to phase one, which is the most restrictive. I can't speak on that, but the principal problem that I have with this issue is, and I work in the healthcare, right? Like I'm a nurse in training, and people keep saying things like it's not real. You have a 99%, was it 98% recovery? Not everyone is dying. You must have comorbidities and all this other stuff they spew. That was never the issue with COVID. COVID was never going to have a 50% mortality rate. First of all, it disturbs me that people would rather have a 50% death rate for them to believe that something is serious than a 99. They see a 99 recovery rate as a sign of weakness. Well, when you have over 250,000 Americans that are dead, I mean, think about it. This is called a game of numbers, right? Statistics. I wish people took it. Obviously, if you have a population of almost 400 million people, even 1% of the population getting sick is a lot. And our hospital systems are not designed to be able to house so many Americans at once, and that is the issue. That means, and I want people to understand this, that means if all of our beds are taking because we're dealing with COVID patients, that means someone that has a heart attack, someone that has a stroke, someone that has a motor vehicle accident that requires major surgery and recovery, someone that has a respiratory failure issue, anything that's a critical medical emergency, they won't be serviced because where are you putting them? And that also means that you might be walking around saying, I don't need a mask, I'm fine. Well, guess what? If someone that you know got sick and they needed to go to the hospital, if all the hospital beds are occupied, that person won't be able to go to the hospital. And guess what now? They're going to be compromised
That's
So
right.
COVID has nothing to do with 99% you won that. The issue is overrunning our hospitals, and I don't think people understand that. Stafford only has one, okay? Stafford Hospital. Fredericksburg has Mary Washington. Spotsy, I don't even know what they have. Forgot what it's called. But imagine, no, imagine this. Just as an argument's sake, let's say Stafford Hospital has a capacity of 50 beds, right? As an argument's sake in their intensive care, which is where most COVID patients are. Stafford's population is somewhere, I would guess, around 170, 180, okay? 1,000 people. If even a 5% of our population got sick, you all will never be able to go into the hospital. You couldn't even go to Fredericksburg. You couldn't even go to Centara. You can't even go to Inova because my rotations are at Inova Fairfax. And the hospitals are so filled that patients COVID adults were being housed in the children's wing of the hospital. So it's not about, well, I'll be fine, or I have mild symptoms, or well, I don't need a mask. It's about overrunning our hospital because you may be fine and you may not have COVID, but God forbid if you were to catch a heart attack, okay, and you needed a hospital bed, COVID didn't help you because you're not going to have space. So you might say, I'm immune from COVID, or I don't need a mask. But you're not immune from a heart attack. You're not immune from a stroke, and you're not immune from a car running you over, or you having some very terrible accident that requires medical attention. And I wish people would get that through their heads.
Not only that, but we don't know what the long-term effects are going to be. And some studies are saying when it comes to heart, lung, and gut issues in the long term, it doesn't look good.
Yeah, like for me, I'm scheduled to go get a pulmonary function test, which is a test that measures your lung capacity and its ability to properly function. Because I had COVID for a while, and I can tell you my breathing is not the same. I don't know what my lung function numbers will look like, but anytime that you have a decreased capacity in your lung function, it's not a good thing. And study says that you don't even have to have had symptoms to have lasting effects. So you could have been asymptomatic and you can still be subject to the long-term effects of COVID. So this cavalier attitude that people have of, oh, well, I'm healthy and I'm fine. I'm like, listen, why tempt fate? I just don't get it. And, and people claim to be Christians and they claim to be, followers. And I'm like, in no part of the Bible it ever says that you treat your neighbors like this. You're supposed to love your neighbor as you love yourself, which makes me think if you don't love your neighbor because you can't wear a mask, then you don't love yourself.
I have had this conversation a couple times, and it's been cast out as a faith thing. You act like you don't have faith. And I've said, if your faith is so strong, start wearing your seatbelt. Go find the nearest cliff and just jump off. See if God's going to save you. Don't tempt God. Please don't use his name like that. Don't do that. If you don't want to wear a mask, you just don't want to wear a mask. Not anything to do with God. But I think a lot of people don't. I work in healthcare also, and they don't see it from where we see it. And a lot of people have a lot of opinions, and they really don't know. Yeah. It's not just about the death rate. It's like you said, it's about the hospitals being overrun. And we're seeing that now in this wave and the flyover country, which really didn't have a problem that bad the first time around. And this is some of the places where people were really anti-mask and all this kind of stuff. But man, it's taking a lot of people out.
Well, I always say people who claim to know what God says in faith are the ones that are least knowledgeable. Because I'm like, he may say you walk with faith, but he also gave you the ability to judge right and wrong. Okay. He doesn't say blindly, just go follow in faith. You have to also have reasoning and judgment, and people are lacking that. And it's a fundamental problem this country has. And a professor at the Naval War College, he talked about it, is called, he's a little conservative, but his principal argument is very, very good. And I suggest people to read it. It's called The Death of Expertise. And in this country, the reason why we are where we are and why in a pandemic, that's something that's so manageable, we've managed to mess it up, is because people all think they're experts. They all want to run in Google or WebMD or Facebook or Twitter and they all think that they have an opinion. No, you don't have an opinion. Okay, you don't. You didn't go to medical school. You didn't go to nursing school. You didn't go to respiratory school. You didn't do any of that stuff. Okay, like I can't go tell a teacher how to teach a curriculum. So why do you think you could tell a healthcare worker what they should be doing, or if their analysis is correct? Um, but that's the principal issue as it relates to Stafford. We have had on average the last couple of weeks we've averaged 29 new cases. I actually have the data here, so I'll read that off to you guys. We've actually have 29 new cases. We've had a 9% PCR positivity rate, which is the polymers chain reaction test that checks that has the most accuracy. We've had in total since the pandemic started 22 deaths, which is great, and we've had 187 hospitalization. I don't know right now. I haven't. Usually the hospitals come and give us the updates, but we haven't had one. So I suspect we should get an update from Mary Washington about what the current hospitalization numbers are. Because I don't know right now, but I know this past week alone, I know the numbers were a little lagging, but we had like 60 new cases in Stafford. So our numbers are going up. The funny part is the first wave, Stafford did really good compared to the other localities. We were really good at our numbers. I think it was somewhere around 2%. And now those numbers have jumped. And the major source of concern for me, at least, is our Hispanic and African American communities, because just like anything in healthcare, racial disparities exist. And unfortunately, these people have been hit the hardest. They have the highest rates in Stafford. I think almost like 40-something% of our cases within those positive cases are Hispanics. And I think African Americans make up like 30%. So we are literally almost like 75% of the cases. And clearly we're not even 75% of the population. So one of the things that I'm working on, and you asked about this earlier, is I had a conference call today with the VDH because I kind of expressed to them when they came before the board, and I was the only one that's been doing this, is we have to protect these communities. And so in about a month, we're supposed to come together with some community organizations. I haven't had a chance to do this, but I'm telling you guys this now because this is what just happened. But my goal is to have some type of health fair within these communities where VDH will be there, community organizations will be there, and we'll be trying to hand out pamphlets. Because some people don't even know how you can get COVID, how you can protect yourself. Hopefully, I don't know if we can get maybe PPE, like mask and stuff, because for some people, you they can't afford a mask. People think, oh, you can just, for some people, it's not that easy.
That's right.
And then also one of the things that VDH told me today that they might be able to swing is try to get some type of rapid testing in these communities so people know. So that's just some of the things that I'm trying to do to help our communities. I'm hoping that I can have this all wrapped up before Christmas. That's my goal, is to have this health. I call it a health fair drive, to have it before Christmas, because when Christmas comes, after Thanksgiving, our number's going to be terrible, and not in Stafford, but this entire country. Because everyone is leaving and traveling, it's going to be a cesspool. I feel that. Yeah. So once I have that information, I would definitely reach out to organizations like yourself. And I know Gary has one as well, and other local community organizations, to try to utilize you guys to get in. Because like I said, they're being left behind, and they're going to be the ones that have greater concerns. You know what I mean? So I'm trying my best to figure out how to get to them, and VDH was willing to listen to me and try to work with me and trying to get that done. So my goal is to get up north done before Christmas, and then once that happens, then come back in the new year and do the southern part of the county. Because the key is, when the vaccines become available, these people have to be able to trust us to give it to them. So utilizing my face, because I don't do things just on a whim or if it's a joke, utilizing my face and doing the legwork now to establish those relationships. I don't want January to come when we have vaccines to people to say, oh, I don't want it, I don't trust you guys. Because I think a new poll said like 40% of Americans said they won't get the vaccine. and a lot of that has to do with a lot of a lack of trust. So having the community be involved in the process with our community leaders and organizations and representatives, I think it can go a long way, at least for Stafford, fixing some of that concerns.
Well, I'm gonna tell you, I really want you to share that with Heart for the Community. As you know, I work with a few other organizations too. Gary is online. Gary is a part of Heart for the Community, also Enough and Stafford Black, along with a few others. And I know that we would absolutely be willing to work with you in that effort. Please, please, please keep us involved so that we can work with you and help you to get out to the community. We need to get the word out.
Yeah, we will. I just need to get all the organizations together, and then once I sit down, then have that call with VDH so that we can organize it, and then hopefully my goal is to get it the week before Christmas to get it done.
I
Um,
have been wanting to interview somebody from VDH, and I don't know
Good
how.
luck with that.
Yeah, you're right, and that's been my thing. I said, man, I need an in. They're not
Well,
answering
it's
my.
hard because with state appointed officials, if you're not elected, you really are not a. You would have to seek permission from your higher ups, and I don't think VDH would give anyone here in the community unless it's in conjunction with a project. So
Right.
maybe with this drive I'm trying to do, maybe we can get VDH to see if they will speak about it, and maybe you can use it as an opportunity. Because my goal also is VDH has not been great with our community of color. They don't have a footprint. So
Mhm.
my goal is to try to fix that, is try to bridge that gap, to be able to get more services, and not just for COVID in general, but going forward, how to have better healthcare access for communities of colors, and not even just communities of colors as well. People who don't have insurance, people who have low socioeconomic backgrounds, anyone that needs healthcare, because when we don't have a healthy population, it's a stress on everyone.
Heart for the Community initiative was actually formed to help that community. When you talk about uninsured, underserved, that really is what we were born out of, to serve that community. So you are right in our wheelhouse when you talk about that. I got one more question I want to ask, and this is a great question from Gary Holland. He says, I'll put it up here too. He says, I'm listening to the Obama's newest book on Audible. He spent some time talking about how community organizing really motivated him to serve. He's asking you, Supervisor Allen, what are your thoughts about the need for community organizing in Stafford? Do we need more or less? Thanks.
Absolutely. I mean, this is one of the things when I talk about. I wish I had more time, because I do plan
You
on.
got all the time you want.
No, not talking. I meant my personal time.
Right.
Uh,
Okay.
I talk. One of the things that I wanted to do, because I get a month off. So the last board meeting is the 15th, and my semester is over on the 11th. So I was gonna have a month off where I was like, I need to recharge because I'm really drained because I'm doing so much. But then I was like, within that month, I also want to start forming organizations that don't exist to represent certain communities. So when I see community organizations like Gary's Enough, I know Vernon Green has one with G3CS and Stafford Black and NAACP. That's great. That's what we want. And but we also want as much representation. So who are our Latinos, right? Who are our organizers for Latinos? Who are organizers for Asians? Who are the community organizers for different religion? Because the thing about it is, the more actors that you have at the table, the more issues that you can um, understand what's happening. Because if you're only always hearing one voice, you don't necessarily have the opportunity to go into a community and truly find out what's really their central problem. And that is what the organizers are for. Their job is to mobilize the voices in their community so they can have a seat at the table. So they can then tell us as elected leaders, hey, this is what we have to fix. They can be the ones driving the message and holding us accountable, as well as serving as partners in public-private relationships, whether it's through business or community action services. One of the things that I recently did was I partnered with Gary's Enough and Mr. Green to help adopt a road for cleanup. And that's just the beginning. But you have to have community organizers, because as an elective leader, you don't always know what's happening. That's what they're for. They're there to tell you what's happening. They're there to also get the messaging out about, hey, this is what we're trying to do. Tell us what we're doing wrong. And when you're a leader and you're involved in the community too, you also get a sense of purpose. I think oftentimes when you've been in politics for a while, and I haven't, but when most people are, they tend to lose their sense of purpose. And having your roots based in the community, you'll always remember those struggles, because I'm telling you, community organizing is not easy at all. I mean, it's grunt work. The amount of work that you have to put in to become established, to get a functioning body, to get people to respect you, to listen to you, but once you have one that has status, it is totally something that is worthwhile. And I would definitely encourage every leader that I know to get involved with organizing, because for me, that was why I ran, because I wasn't a community organizer, but I had my ears to the community, that I knew what the issues were. And I took that with me and said, how can I take the fundamental issues that are wrong in my community and turn that into legislative action? Because you can't always legislate for people that don't need your help. That's my thinking. I don't need to legislate for you if you already made, quote unquote, made it, or you don't have as many issues. I need to legislate for the people who need government to work for them.
You know what? I wish more elected officials had your heart about that. And I think you're so refreshing to people like me, who sometimes you just look at some of the stuff that we see and you're like, where did they lose it? You're supposed to be the government of the people, by the people, for the people.
Well, like I said, I remember one person asked me, what is your purpose for running? If you couldn't tell me what your purpose for running, and I'm not talking a cookie cutter answer. If you couldn't come off to me with a genuine answer, then you shouldn't run. And my story, it's part of my upbringing. I don't make any of it up. I mean, if you see me, this is exactly how I am. I don't have two faces. I can, because I came as an immigrant. My mom worked for $5 an hour. We slept on strangers' floors. I had to, when school started, we used to have to go to the Salvation Army to get food, get clothes. I used to have to go to the pantry. I remember for dinner, we would eat a bowl of rice and maybe some sugar. You know what I mean?
Mm-hmm.
I've lived in public housing. I've lived in a 2-bedroom apartment with 10 people. I've slept on floors, and then I transitioned that and I went to an elite university and I saw what life was like. And I said to myself, there's so little of me that exists in this world. How do I fix that? Because I don't ever want to have anyone have to endure what I endured, and I said to myself, as long as I'm in a functional capacity, my goal is to try to fix as much of those issues that I endured so that no one has to endure that. Because my thing is, anyone, is has God-given talent. It's just opportunities that are presented to them. And for a lot of people that look like me, there aren't that many opportunities. The system is gamed against us, regardless of what people say. So that's why I got into politics. That's why I got into healthcare. My end mission is either to change policy as well as to work for low-income neighborhoods, whether it's free clinics or free hospitals. But my purpose on this planet is never about me. My purpose is to serve others. Because I always tell my mom, and my mom always laughs, I said, if God wanted me to enjoy this planet by myself, he'd made 7 billion copies of myself.
That's right.
I mean? But he didn't.
He didn't.
So I think mankind has to be of service to each other. And I think because we don't have that, we have all these issues because people are in service to themselves.
You said it, and let me tell you what kind of impact you've made. Look at this comment. Dropping knowledge like A-bombs. Thanks for the format, Carl. Thanks for your time and insight, Supervisor Allen. I told you that Gary loves you.
I know. I will say, if anyone is interested in running for the upcoming election cycle, I know Gary has reached out to me about, trying to help people because I learned on the fly. Like there was no one else that could have helped me. Granted, I have a background in political science, but I'm more than willing to try to get people prepared for the process, because it's not just about, oh, I want to run. It's also about when you run, how do you become an effective candidate? Because you might truly be the better candidate, but if you're not effective in your messaging and understanding how to be true to yourself and to people, the lesser candidate, because they've had a more effective campaign, will win, and then change doesn't happen. So if anyone is interested in running for any of the 4 seats, it's Hartwood, Aquia, Garrisonville, and Falmouth, and it's also for the school board. Feel free to reach out to me on my county website email. It's Tinesha Allen. It's not Tanisha Allen. It's T Allen at staffordva.gov. Or reach out to Gary or your organization to get in touch with me, and we can organize something. Because we need more community leaders in those positions, because we won't ever have change. Not the structural fundamental change that Stafford made.
I agree. Supervisor Allen, I truly, truly appreciate you taking your time. I know that your time is limited. You're doing so many things, and that's why I really am honored, and I'm not serving lip service. And I want the audience to know, for those of you who have not had the opportunity to spend time with Supervisor Allen, she just said a few moments ago she doesn't have two faces. I'm telling you, everywhere I have seen her, and I've seen her in places where she didn't see me because I'm an observer, she is the same person. So when you see her out, what you just saw here is what you're going to see. And when you approach her and ask her a question, just like she answered it here, unless you're just weird, she's going to answer. And here is Princess. She said, we definitely need more community leaders. Yes, Princess, you are correct. I agree with you, Supervisor Allen. And as much as I have often said, no, I'm not going to run for office. Every time I have one of these conversations, I'm thinking, yeah, maybe I should. We'll see.
Hey, listen, the only thing I'll leave you with this, and it's a quote that, honestly, I know it sounds cheesy, but it's something that even those days when when I was little, I mean, I've always been a student of history, and I have a really high aptitude for history and politics. And when I was younger, one of the things, because I realized at a very early age, the true agent of change has to use the system against itself, right?
That's right.
You got to be able to topple the system from within, because it's possible. When people say we need to destroy this, yeah, you destroy it from within, because you put people in there that can change the system. But the only way that you can change it, and the only way that you are not scared is, FDR in one of his fireside chat said, the only thing you have to fear is fear itself. You won't ever know unless you try. And if you fail, there's always a lesson to be learned in failure. Failure is never the end all and be all. Maybe being a political person is not for you, or being an elected official, but maybe within that process, you would find out so much more about yourself that you can find your niche to affect change. Because change doesn't only come from people that look like me in terms of an elected official. Change comes from community people, from ordinary citizens exercising their power and their voice. So I would tell your viewers, regardless in general, you have nothing to fear but fear itself. And fear will cripple you, and fear will take control of your life and prevent you from doing the things that you truly feel that needs to get done. If you fail, all you're going to do is fail to succeed. That's it.
Wow, we appreciate that. So, Gary is a run call. You have my vote. Yeah, I'm a run if you be my campaign manager.
Where do you live? Which district do you live?
I live in your district, but I'm not running against you.
You run against me.
No. I won't do that. I will help you.
I don't even know if I'll run again, to be honest. I look at this as a one-time, and that's the thing too. And I don't want to suck up your viewers' time, but the principal problem too is politicians look at this as a come up. Like, what is the next thing I can do to position myself to be, a power player or financially secure, or I like the power that comes with this. I look at this as, listen, I've got 4 years to do my job. If I don't do X, Y, and Z in 4 years, I will judge myself accordingly. But I'm not gonna cast a vote. I'm not gonna push agenda items. I'm not gonna do anything because I want to get elected. And if you don't believe me, ask people who email me and threaten me and say to me, Oh, I won't vote for you. Okay. That's not going to stop me from doing what I believe fundamentally to be the correct thing.
Well, Princess wants to know what's next for you, Supervisor Allen.
Well, I have so many people. Gary wants me to be a consultant. A friend of mine wants me to be a consultant. Someone else wants me to run for higher office. I've gotten approaches to think about consider running for state offices, but I just don't think I'll be affected that way. Because, like I said, you don't have to be an elected official to be an agent of change. You just have to find how to affect change. And so for me, my agent of change is to utilize the healthcare industry to fix a lot of the racial disparities because I fundamentally believe health is wealth. And if you don't have healthy people, then they cannot maximize their potential. And if you keep exacerbating the racial disparities in the healthcare system, you're just having an entire system that's going to oppress a bunch of people. So for me, it's fixing the healthcare system, maybe a little bit consulting. I don't know. Who knows? In 3 years, I could have a totally different view and say, I'm going to run for XYZ. I don't know. But as right now, I live in the moment. I focus on my job. And I always say, what God has ordained for me, it is written. I can't change it. So I can sit here and pontificate and tell you I'm going to do X, Y, and Z. I have no idea what he's going to do for me. And I'm telling you a real story, to end the conversation. I know I've said this a ton of times, but when I was getting ready to graduate from Vanderbilt, I was getting ready to go to law school. Like applied, I was like, yeah, I'm gonna go be a lawyer. I'm gonna be a corporate lawyer. I'm gonna make so much money because I grew up poor, so I was like, so much money. I'm gonna apply to X, Y, and Z because at that time my friends were going to Harvard and Berkeley and all that stuff. And I was like, yeah, I'm gonna go to Columbia, go back home. I got sick, like real sick when I was like in the hospital sick. From no one knew what I got sick from. I got better like a month later. And I was like, okay, I'm going to go back and apply for law school. I got sick again. And I was like, dang, is this a message being sent to me? And every time I keep doing something that I'm not ordained to do, I keep getting sick. The only time in my life I've been successful, whether it's personal, financial, and social, is when I chose to dedicate my life to helping people. That is the only time all these doors opened up. I got scholarships to nursing programs. I got job offers. I've met people to help change healthcare system. I've met world leaders, all of it. And the minute I think about going back to law school, those doors close again.
Don't do it.
I don't know.
We don't want you to get sick again. Yeah. Listen, audience, if you want to be in contact with Supervisor Allen, all you have to do is go to the Stafford County website, and where you see the Board of Supervisors. And once you click on her name, all of her contact info will come there. And listen, she does read her emails. And when you see her out in public, ask her a question. Like I said, as long as you're not too weird, she'll answer you. She'll
and you will never see me in public with suit. I mean, unless it's an official event. But you'll see me with jeans, t-shirts, sweatshirts, tennis shoes, everything under the sun. I'm just, so I'm a very down-to-earth person. I'm approachable as long as you're not difficult. And even then, I mean, you have to be absolutely terrible. But I'm very approachable. I will try to answer your questions as best as, and if I don't know, I try to find the answers. I try to be efficient in how fast I answer people. Because like I said, I'm my own boss as well and my own staff. So I have to do work and answer emails and arrange meetings. It's just too much. But I try to be
volunteer staff.
I know. So people said that to me. They was like, we can't have the one black person not have as much help as possible. I said, if I have as much help as possible, they're really going to be in trouble.
Well, y'all hear that, right? We have to get Supervisor Allen a volunteer staff. So all of you that have all those administrative skills, come on now. Let's do something. Let's see if we can get her a couple of people that can help her for real. Now, you can't volunteer to help and then quit after Christmas. So let's see what we can do. Supervisor Allen, it has been an absolute pleasure to have you on Heart for the Community Initiative again. And I'm hoping that the next time I ask you for an interview that you'll say yes. I'm going to try not to wear you out. Now, I would love to have a Supervisor Allen spot every month for about 30 minutes. But we'll talk about that later.
I'm not opposed to that. It would just have to be. I think I would probably do quarterly as more efficient as opposed to monthly because sometimes we only have 2 meetings in a month
Right.
and we might not get as much done. So I would say, every 3 months, I wouldn't mind have a standing spot where I can update people because at least that way you have 3 months worth of stuff to be able to share with people as opposed to just listening to me talk about, you know, everything.
Well, I tell you what, when I start making my February calendar, I'll have you in
No,
mind.
that's too soon. You got no. December we're off, so you would have to start at March,
March, huh? Okay.
just
Well, there
before
it is.
budget. Yeah, just before budget season, because March is the start of a budget season, and then from March to um, June is when we vote on the tax rate. So that can be one. And even in between budget season, I can come and answer questions because I'm telling you guys, the key is budget season. If you want to know how your money's being spent and allocated and why you don't have certain resources, you need to pay attention from March to June.
All right. You got it right from Supervisor Allen. We'll be right there with you. Thank you so much. Heart for the Community Initiative audience, you have been great. You have hung with me, and hopefully you got something very good out of this. I want to give a shout out to the homie, Beverly Foreman. Thank you for being a part of the audience, my friend, and thank you for your comments. And Jeanette Underwood Holland said, Tanisha is awesome. Yes, she is.
Hey, listen, Miss Underwood is my de facto stylist.
Yes.
Whenever I have a messaging that I need to get out, I send it to her. Hey, next Tuesday I'm gonna have a shirt that's gonna be that's been designed by her that I'm gonna sit there and I'm gonna send a clear message. You'll see it if you tune into the supervisors meeting, or I'll take a picture because she wants me to take a picture. But yes, but thank you guys for having me. I wish you all a very safe Thanksgiving. Please, please take COVID seriously. Don't, this is not a joke. Don't play the what if game. But at the same time, find a way to be creative with your family. Whether it's having Zoom Thanksgiving, it's not the end of the world. First of all, the turkey's dry anyway, right? So
not mine.
but you guys have a wonderful holiday season. Enjoy family, enjoy yourselves, and have a happy new year. And 2020, January 20th is almost here. 2021.
Yes.
Okay, it's almost here. Just hang in
It's
there.
coming. It's coming.
It's coming.
Thank you so much, Supervisor Allen. We appreciate you. Thank you, Heart for the Community Initiative audience. Listen, I want y'all to know that I'm getting myself organized. I'm working on December and January schedule for Heart for the Community Initiative and Carl's Conversations. I have some treats for you. Do you guys remember A Real Talk for Women? Well, I'm cranking that series back up. I've already got 3 episodes planned for the month of December, and I got some hot topics. Ooh, 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 ooh. We are going to be dealing with a lot of things. Remember, we are here to be informative to the community. There are a lot of issues that need to be dealt with, and I know I take on issues that a lot of people won't. That's my gift, I guess. So we're going to do it. I want you to stay tuned. Please don't forget to go like and or follow Heart for the Community Initiative so you can keep up with the things that we're doing. We thank you so much once again, Supervisor Allen. You have been great. This is your second time here, and we look forward to seeing you again. So until next time, audience, I say may God bless you and may heaven smile upon you. Until next time, good evening. Happy Thanksgiving to you. Bye-bye.